Did you know that 1 in 3 adults in the USA suffers from metabolic syndrome? This alarming statistic may have you wondering, what exactly is metabolic syndrome? Metabolic syndrome isn't just one condition, it's a collection of health issues that, when they occur together, substantially increase the risk of heart disease, stroke, and type 2 diabetes. Now you might be wondering, what are these health issues that make up the metabolic syndrome? Let's break it down. Firstly, we have central obesity. This isn't your regular kind of obesity. It's characterized by an excessive amount of fat around the abdomen, and it's often indicated by an increased waist circumference. This is a key feature of metabolic syndrome. Secondly, we have insulin resistance. In this situation, cells in the body become resistant to the effects of insulin, a hormone that helps cells absorb glucose from the bloodstream. When cells resist insulin, blood sugar levels can rise, leading to numerous health complications. Thirdly, there's high blood pressure, also known as hypertension. This is a condition where the force of the blood against the artery walls is consistently too high. It contributes to cardiovascular disease, a major complication of metabolic syndrome. Next, we have abnormal cholesterol levels. This includes high triglyceride levels, a type of fat in the blood, and low high-density lipoprotein or HDL cholesterol levels, often referred to as good cholesterol. The fifth component is a prothrombotic state. This involves an increased tendency for the blood to clot, which can contribute to heart disease. Lastly, there's a pro-inflammatory state. This is chronic low-grade inflammation often associated with metabolic syndrome and contributes to various health problems. Now that we have defined metabolic syndrome, let's delve a bit deeper into its components. Understanding them is essential in recognizing the severity of this hidden epidemic and the importance of early detection and management. Stay with us as we continue to unravel the mystery of metabolic syndrome. The first component of metabolic syndrome is central obesity. This is characterized by an excessive amount of fat around the abdomen, often indicated by an increased waist circumference. It's not just about how you look on the outside, it's about the potential health risks this fat carries on the inside. Next on the list is insulin resistance. This is when your body's cells become resistant to the effects of insulin, a hormone that helps them absorb glucose from the bloodstream. When cells resist insulin, blood sugar levels can rise, leading to various health complications. The third component is high blood pressure or hypertension. It's a condition where the force of blood against your artery walls is consistently too high. It's like a continuous, unseen battle happening right within you, contributing to cardiovascular disease, a major complication of metabolic syndrome. Then we have abnormal cholesterol levels. This includes high triglyceride levels, a type of fat in your blood, and low high-density lipoprotein or HDL cholesterol levels, often referred to as the good cholesterol. It's like having too much of the bad guys and not enough of the good guys in this scenario. The fifth component is a prothrombotic state. This involves an increased tendency for your blood to clot, which can contribute to heart disease. It's like a sticky situation, but in your blood vessels. Last but not least, we have a pro-inflammatory state. This is chronic, low-grade inflammation often associated with metabolic syndrome and contributes to various health problems. It's like a smoldering fire that never really goes out, causing damage over time. Metabolic syndrome is not just about one of these components, but a cluster of them occurring together. The causes and risk factors can be genetic, related to insulin resistance, age, ethnicity, or lifestyle choices. The risk of metabolic syndrome increases with age, and certain ethnic groups may be at higher risk. Prevention and management of metabolic syndrome involve lifestyle modifications, including a healthy diet, regular exercise, weight management, and stress reduction. In some cases, medications may be prescribed to address specific components, such as high blood pressure or elevated cholesterol levels. Regular monitoring of blood pressure, blood sugar, and cholesterol levels are also essential. If you're a smoker, kicking the habit can do wonders for your overall cardiovascular health. And let's not forget the importance of stress management. Chronic stress can contribute to metabolic syndrome, so adopting stress-reducing practices like yoga or meditation can be beneficial. Remember, addressing metabolic syndrome involves a comprehensive and individualized approach. It's always recommended to consult with healthcare professionals for proper management and guidance. These components, when occurring together, significantly increase the risk of serious health complications. So, what causes metabolic syndrome? Are there factors that make some people more susceptible than others? Well, indeed there are. The culprits behind metabolic syndrome are multifaceted and can include both genetic and lifestyle factors. Genetics play a significant role. If metabolic syndrome runs in your family, you are more likely to develop it. This is not a life sentence though, it's a wake-up call urging you to be proactive about your health. Next, we have insulin resistance, often associated with obesity, physical inactivity, and an unhealthy diet. When your body becomes resistant to insulin's effects, it paves the way for metabolic syndrome. Age is another factor. As we age, the risk of developing metabolic syndrome increases, but again, healthy lifestyle choices can mitigate this risk. Lastly, certain ethnicities, including African Americans, Hispanics, and Asians, may have a higher propensity to develop metabolic syndrome. Now that we know what causes metabolic syndrome, how can we prevent and manage it? Preventing and managing metabolic syndrome is no small task, but it is achievable. Let's start with lifestyle modifications. Adopting a healthy eating plan is paramount. This includes a diet rich in fruits, vegetables, whole grains, and lean proteins. Regular physical activity is another critical component. It not only promotes weight loss but also improves insulin sensitivity, helping to regulate blood sugar levels. And speaking of weight, managing it is crucial in battling metabolic syndrome. Achieving and maintaining a healthy weight can significantly reduce the risk and alleviate symptoms. Now, lifestyle changes are vital, but sometimes they're not enough on their own. That's where medications come in. Depending on the specific components of metabolic syndrome you're dealing with, medications may be prescribed to address issues like high blood pressure or elevated cholesterol levels. Always remember, medications should be taken as directed by a healthcare professional. Regular monitoring is another key aspect of managing metabolic syndrome. Regular checkups and keeping track of your blood pressure, blood sugar, and cholesterol levels can help identify any changes and ensure that the steps you're taking are effective. If you're a smoker, quitting is a significant step towards improving your cardiovascular health and reducing the risk of metabolic syndrome. Smoking has been linked with many health issues, including those that contribute to metabolic syndrome. And finally, let's talk about stress management. Chronic stress can contribute to metabolic syndrome. Adopting stress-reducing practices such as yoga, meditation, or even something as simple as taking a walk in nature can help. So yes, combating metabolic syndrome is a challenge, but with the right steps and a dedicated approach, it's a challenge that can be met head-on. It's about making the necessary changes in your life and sticking with them, even when it gets tough. Addressing metabolic syndrome involves a comprehensive and individualized approach. Consultation with healthcare professionals is recommended for proper management and guidance. Remember, knowledge is the first step towards better health. Stay informed, stay healthy. Before we conclude, we would like to take a moment to invite you to be part of our growing community. Please, hit the subscribe button now and join the Medicine Health 360 family. If you found this video helpful, give it a thumbs up. Your support helps us continue to create content that can enrich lives and spread awareness about critical health issues like metabolic syndrome. Our channel is a treasure trove of interesting, challenging, and high-quality videos that delve deep into the world of medicine and health. We aim to break down complex health topics into digestible and understandable information so that you can make informed decisions about your health. At Medicine Health 360, our mission is to bring the most crucial, latest, and systemic medical and health knowledge to everyone. We believe that information is power, and we're committed to empowering you with the knowledge you need to live a healthier, happier life. For better health and a better life, subscribe to Medicine Health 360 today. Let's conquer health challenges together, one video at a time. Thank you for your support, and remember, your health is your wealth. Stay informed, stay healthy.